Hi friends, I am Dr. Pratap Rathod. I have done MD in Pharmacy Medicine, and today we'll discuss about sexual paraphilias. Sexual paraphilias, also known as sexual perversions or sexual deviations, are persistently indulged sexual acts or fantasies in which complete satisfaction is sought and obtained without sexual intercourse. So here, the person gets sexual gratification other than sexual intercourse by some sexual acts or fantasies. It is characteristically the person or sexual pervert is a person must have experience in perversion for a period of 6 months or more, and the behavior must cause significant distress or impairment in social, occupational, or other significant areas of individual functioning. So, to tell a person to be of having sexual paraphilia, he should suffer that symptom for 6 months or more, and because of that, he should have some significant distress or impairment in social or occupational areas. It is found more commonly among men compared to females. As most of the deviations are very harmless, it is commonly doesn't doesn't have brought into notice of law and police. Some psychological aspect of sexual paraphilias. According to Freud's psychosexual stages of development, can make understand psychological aspect of how a person turns out to be a sexual pervert. So according to Fruits, he made some psychological aspect on how person can develop a sexual perversions. As per this, every human being with his physical maturity undergoes psychological maturity also concerned with sex. So he defined that every human being other than physical maturity also undergoes psychological maturity related to concerned with sex. It is proposed that this psychosexual development occurs from infancy to puberty in the form of 5 phases. So he divided these phases into five the psychosexual development into 5 stages. The first phase is the oral phase, which lasts from 0 to 1 year. Here, this is includes like a child, newly born infant. Within 1 year, they usually under have related to uh, affect psychosexual development in the form of mouth, like sucking, kissing, or crying. Those are the acts they done. Urethra anal phase, about 1 to 3 years. Here they start having controlling their urination and defecation and have the impulses about that. In phallic phase, about 3 to 5 years, they usually undergo a phase where they try to understand the sex of other opposite sex in 3 to 5 years. They may try to remove their they may genitalia expose their genitalia to opposite sex or try to see other sex children's sex, try to understand it. Latency phase about 5 to 12 years is a phase where they stop having sexual undergo puberty, and genital phase 12 to 14 years they start doing self stimulation like masturbation cases. So during sexual development, there is a possibility that maturity can get arrested at one of these 5 phases while physical growth continues further. So usually he defines that well, if the person's physical maturity continues but his psychosexual development stops, like for example, a male who is arrested at oral phase may turn out to be a person enjoying sex by practicing oral sex. Similarly, in phallic phase, he may try to open his, he may try to undress and indulge in exhibitionism. So that's how he defines sexual paraphilic or sexual pervert to be based on psychosexual development. The most common sexual paraphilias include sadism, masochism, transvestism, exhibitionism, voyeurism, fetishism, fetishism, and pedophilias. Others unspecified like masturbation, urophilia, coprolalia, scotolalia, necrophagia, necrophilia, all others are present. So first coming to sadism, it is also called as active algolagnia. So the term sadism comes from a French nobleman Marcus de Sade. So was infamous for his writings about pornography, sex, and he used to indulge in sexual gratification by uh, doing acts by beating his wife. In sadism, usually, so this term comes from him. In sadism, sexual gratification is obtained or increased from acts of physical cruelty and infliction of pain upon another partner. So usually in sadism, the person indulges gets a gratification when he have some physical cruelty towards the opposite sex. Again, it is more commonly seen in men. To obtain sexual gratification, the sadist may try to bite, beat, whip, produce cuts, cigarette burns, etc., or treat or torture his sexual partner in many other cruel ways. Extremely sadistic attacks may made in which the victim's nipples may be bitten off. Articles such as bottle, candle, or sticks are inserted in the vagina. Cigarettes or lighters may be used to burn the skin, or blows which may rupture the internal organs or cause fracture. Sadism usually develops in early experiences because of early experience of brutality in relation to sex. Many are sociopathic, may have schizoid or other inadequate personalities. That is about sadism. Now coming to masochism, which is also known as passive algolagnia. The term is derived from name of Leopold van Schacher Masoch, who was an Australian novelist. Again, he used to have these fantasies. Fantasies are getting gratification from being whipped by his wife. He used to get a stimulant for his literary work. So whenever he gets beaten by his wife or abused by his wife, he used to get inspiration for writing the literacy. This is again a condition is opposite, complete opposite of sadism. In masochism, sexual gratification is obtained or increased by suffering of pain. Masochists usually get pleasure from being beaten, abused, tortured, humiliated, enslaved, degraded, or dominated by their sexual partner, and they tend to place themselves repeatedly in self-defeating situations. So they tend or request their partner to degrade him, enslave him, humiliate him, or beat him, so that he gets gratification and stimulation. Such painful stimuli may entirely replace the ordinary sex stimuli, and he just indulges in getting beaten up. It is usually found in males, but it may be found in females who may willingly expose themselves at the risk of severely bodily injury or murder at the hands of brutally husbands or lovers. So, so it is considered as sadomasochism, where the both the person, one partner may have sadist activity and other party may have masochistic activity. So both may be combined, may be seen. So sadomasochism are rarely found in a pure state. They are usually found in combination with one type dominant over the other. Combination of both these practices is called as a bondage. They are found in all the age groups and in all socioeconomic levels. The act of cruelty appears with sadomasochistic may serve as a stimulant for as a complete substitute for sexual intercourse. So here there is no sexual intercourse but gets gratification only by doing sadomasochistic activity. So algolagnia is a term which includes both sadism and masochism. Active algolagnia is sadism. Passive algolagnia is masochism. Medical legal importance. It is a dangerous perversion as the victim may turn to succumb into lust murder. Sadist may be hospitalized for his mental problems, and in India, sadism is punishable sexual offense whenever reported. Now coming to lust murder. So this is a form again for like extreme form of sadism, where murder serves as a stimulus for the sexual act and becomes the equivalent of coitus. The act being accompanied by erection, ejaculation, orgasm. So here, in this extreme form of sadism, the person may beat the other partner to death, and with associated with erection, ejaculation, orgasm obtained from that death. In this characterized by periodic outbreaks due to patient's recurrent compulsion or sudden outburst of sexual desire. So this is usually associated with the sudden desire, sexual desire to do act. There is outbreak and person has a compulsion to do this act. This is associated with cutting or stabbing of breast, genitalia or of the lower abdomen. Usually with sucking, licking, mouthing of the wounds and biting of the skin are also seen. There is erection and ejaculation may sometimes be followed by sexual intercourse with the dying or injured victim. His behavior is usually normal until the next outbreak. So it is usually associated with sudden desire, sexual desire, and have an outbreak of compulsion of doing this act, which may lead to erection, ejaculation, and even intercourse with the dying victims. Many rape murders result from aggressive sexual reaction to inner fear. In true lust murders, mental disease is quite frequent. Every murder committed during sexual act is not a lust murder. This is should also be seen that if whenever there is an act death because of sexual act, is not every murder is not of a lust murder. Lust murder to be qualified, the person should have a compulsion of doing the act because of sudden desire. Now coming to next sexual paraphrase, transvestism, also known as eonism. So transvestite is a person who whose whole personality is dominated by desire to be identified and thought of as a member of the opposite sex. So here the person desire to be of opposite sex, so he tries to dress as the opposite sex, behaves as opposite sex, and even extremely may try to surgically modify his body to become a opposite sex. These are disorder characterized by recurrent, intense, or sexual arousing fantasies, sexual urges, or behavior involving cross-dressing. So he try to cross-dress and get fantasies or sexual desire for to of opposite sex. His dress, manner, occupational interest, and associations are all designed to increase his feeling for of being opposite sex. Sexuality with him is relatively unimportant except as it promotes his feelings of femininity. It is usually found in males who obtain sexual pleasure by wearing female dress. So it is sometimes it is many times it is not commonly seen in all the homosexuals, but it is seen some homosexuals where they try to cause dress as a other sex for a female to get sexual pleasure. Now coming to next sexual paraphilia is exhibitionism. So exhibitionism is a getting pleasure by exposing private parts in public in the front of opposite sex individual, sometimes performing masturbation. So here the person opens, exposes his genitalia, private parts in the public, and even may try to perform masturbation in front of others. So in that form, he get erection and gets sexual gratification. Usually occurs before adulthood. It is done mostly by means often to children or a person of opposite sex. So they usually have exhibits their genitalia towards children who are unaware of that, unaware or unknowingly just visualize that, and also sometimes towards the opposite sex he may perform. The pervert adopts the childish method of attracting attention to himself to experience sexual gratification at the time of exhibition without physical contact. In some cases, the act is premeditated. Occasionally, women may also expose themselves in public. Majority of exhibitions are psychopathic and suffer from compulsion neurosis and suffer from alcoholism, epilepsy, or senile dementia. It is obscene act punishable by Section 294 IPC with imprisonment for 3 months or fine. So if anyone is found exposing their genitalia in the public places, are punishable up to 3 months according to Section 294 IPC. Next form of sexual paraphilia is voyeurism or scotophilia. So voyeurism, also known as peeping Tom, is defined as one who experiences recurrent, intense sexual arousing fantasies, sexual urges, or behaviors involving the act of observing an unsuspecting person who is naked, in process of disrobing, or engaged in sexual activity. So here, the voyeur, the person who is indulging in sexual gratification, gets arousal or sexual gratification urges involving the act of seeing other person naked or process of unrobing whenever person tries to remove the clothes, or if the other persons are engaged in sexual activity, he gets sexual gratification. So they usually go to some other places, peeps through the windows to see whether when they unrobe, disrobe, or seeing naked of other sex. These again are counterpart of exhibitionism. Masturbating at the scene of crime, scene at the later at the memories of watching the unsuspecting stranger is normally a source of sexual pleasure. The onset is usually before the age of 50 and may be chronic in nature. This perversion occurs in case of severe sociopathic personality disorder. Usually such persons do not commit a major sex crime, but sometimes they may assault the victim or commit a murder. So they usually observe the disrobing by hiding in some places. They do not commit any crime, but if they caught, sometimes by accident, they may try to commit a murder also. Next form of sexual paraphilia is fetishism. So fetishism is a fixation on an inanimate object or a body part that is not primarily sexual in nature and the compulsive need for its use in order to sexual gratification. So here the person gets fixated on certain object, inanimate animate object or a body part of a person primarily for getting sexual pleasure. So here he doesn't indulge in any sexual gratification by doing any act, but just having that object or a body part in that seeing the body part of that he gets sexual gratification. In this, the person experiences sexual excitement leading to orgasm from part of the body of a woman or some particle belonging to her that normally has no sexual influence on the mind. So usually he just observes some parts of the body of a female and gets a gratification, or observes or handles the some parts of the part of the body of a female or gets gratification. Example like underclothing, braziers, petticoat, stocking, shoes of a female, which act as substitute for female love objects. In some cases, picture of the fetish object provides sufficient stimulus. So you may just observe some pictures of certain objects, part of the body, like breasts or legs or hands, and gets pleasure. Sometimes the act of stealing the articles provides adequate sexual satisfaction, though the often fetish articles is stored to the satisfaction of the fetish, or touching it gives him sexual pleasure, or he may masturbate into the object. So usually the person stealing that object gets gratification, or touching it get gratification, or rubbing against his genitalia get gratification. He may masturbate inside the object also. It is almost exclusively seen in males. It is harmless, but rarely it may drive the person to obtain his fetish object through violence, other criminal act, like objects may be stolen, or woman may be attacked either as a part of robbery or violence, or because the fetish provides the trigger for rape or indecent assault. So if he may try to steal, and the time of that he may try to attack a woman or perform a rape also. Next form of sexual paraphilia is photorism. Photorism or toucherism is obtaining sexual arousal and gratification by rubbing one's genitalia against a non-consenting person in public places. So here the person gets gratification by just having rubbing his genitalia against other persons. Here sexual satisfaction is obtained by rubbing his private parts against a female's buttocks, thighs, breast, or genital area in crowded places like buses, trains, or some public places where there are crowd is present. Public gathering, he may try to touch his genitalia against the female's buttocks, or he may try to touch the breast or genital area. If they attempt intercourse, they have premature ejaculation, or usually they are impotent. This is an offence and punishable under 290 IPC with fine up to 200 rupees, and again in 291 IPC it is punished up to 6 months of fine. Next, coming to pedophilia. So it is a recurrent, intense sexual fantasies, urges, or behaviors involving sexual activity with a prepubescent child or children who is less than 13 years of age by a person who is more than 16 years of old, or at least 5 years older than the child. So here the person have sexual gratification urges towards a child who is more less than 13 years of age. So any adult or more than 16 years of age person have these fantasies towards a child is considered as pedophilia. Pedophiles are usually men and may be attracted to either or both sexes. Typically, activities from just looking at the child, undressing, fondling, acts like orogenital contact, rubbing the penis between the orifices or thighs, and actual penetration may also be conducted. So here the person may try to have undress the child, try to do oral sex or anal sex, or make him touch, gets a gratification by touching the child, making the child to touch his genitalia. So anyway, he gets gratification by any of these acts. This is again this is punishable under POXO Act, where it comes under as POXO Act, has a form of child abuse, and it is punishable up to it may extend from 7 to 10 to life imprisonment. Next is necrophilia. In condition, there is a desire for sexual intercourse with dead bodies. So here again, it is a form of extreme form sadism, but here the person doesn't kill a person, but he has desire for sexual intercourse with the dead bodies. It is said to have sadomasochistic foundation, and that decomposing, foul smell, and coldness act as a stimulant for having sexual intercourse. The offense is usually committed on the newly buried corpse, or a body awaited for burial. The corpse may be treated following intercourse. So here, in newly buried bodies who are yet to be decomposed, he may try to have sexual intercourse with the bodies. Similar to that, necrophagia is an extreme degree of sadism in which the person, after mutilating the body, sucks, licks the wounds, bites the skin, drinks the blood, and eats the flesh of the victim to derive sexual pleasure. This is against extreme form of sadism where he gets sexual pleasure by licking the wounds, biting the skin, drinking the blood of the victim. Murder for the purpose necrophilia is very rare, Both necrophilia and necrophagia are punishment under 297 IPC with imprisonment to 1 year and fine. Next, coming to uranism, sexual paraphilia. Uranism is a gender term for sexual perversions which includes sexual gratification by fingering, fondling, licking, and sucking of genitalia of opposite sex. So, any form of sexual perversion where the person try to finger, fondle, or lick or suck the genitalia of opposite sex is considered as uranism. These again have many other sexual paraphilias which we will discuss. One is sexual oralism, where it is sexual gratification obtained by application of mouth to the sexual organs. It is seen both in heterosexual as well as homosexuals. Few examples includes anilingus, where it is kissing, licking, and sucking of anus of by a sexual partner. Cunnilingus, by kissing, licking, and sucking of female genitalia by a partner. Or fellatio, where it is stimulation of penis by the partner's mouth. So anyway, any mouth is used for stimulation of opposite sex is a sexual oralism. During these procedures, there may be repeated thrusting of the tongue over the mandibular incisors, which may cause injury to the tongue or ulceration of the lingual frenulum. So the person who is indulging oralism, there is chances that the tongue, because of thrusting of tongue over the mandible, there may be injury to the tongue as well as ulceration may also occur. Non-consensual fellatio may result in bruising of the soft palate and at the junction between soft palate and hard palate. Laceration of frenulum and bruising of abrasions of the lips may also be occur because of non-consenting oralism. Next, coming to masturbation. So this is again sexual paraphilia. That by definition, masturbation, also known as onanism or autoerotism, is a deliberate self-stimulation which affects sexual arousal. Here, the person gets sexual gratification by self-stimulation of his genitalia. Mild masturbatory exercises are common both in men and women and are of little importance. Many times it is done by different methods. In males, it usually by manually by moving the penis against a bed or by any other object by hand or any other way. Moving the penis between the hands can also get pleasure. In females, it is usually a finger is gently rubbed rhythmically over the clitoris, or some hollow articles like bottles, test tubes, or articles made of rubber or plastic are used to stimulate the female genitalia and get orgasm or ejaculation in males. Masturbation is not an offense if it is done privately, but it becomes an offense when it is practiced openly in public places like telephone booths and lavatories. Next, coming to tourism. It is a sexual practice involving three persons, two of one sex and one of opposite sex. So here, it is an extreme form of voyeurism where the perverted husband gets sexual satisfaction in inducing his wife to have sexual intercourse with another man and by watching them at the same time. So here, the person forces her wife, her husband forces her wife to have sexual intercourse with the other man, and just by watching he gets sexual gratification. Next is mixoscopia. It is a form of voyeurism in which sexual gratification is obtained by sight of others engaged in sexual intercourse. So it is a form of voyeurism where the person gets sexual gratification by observing sexual intercourse of other partners. Play piercing. It is a form of sex play often performed alone or in means of stimulating genitalia. Here they pierce their other genitalia by using some pointed objects like disposable hypodermic needles, pins, sewing needles, even nails may be used. The application of removable clips may cause localized swelling or minor trauma. Next is Bobbitt syndrome. This is a type of perversion in which the female partner amputates the penis of her male partner with sharp cutting weapon. So here the woman gets pleasure by cutting the penis of opposite sex. Zoophilia, it is sexual satisfaction is obtained from fondling of animals. So here the person handles the animals, stimulates the animals and gets gratification. Undism, in this the sexual pleasure is often obtained by witnessing the act of urination by someone of same or opposite sex. So here the person again is form of voyeurism where the person gets sexual gratification by seeing the act of urination. It may be of same sex or opposite sex. In some cases, the pleasure is obtained by being urinated upon by the loved one or in urinating on him or her but this is very rare. In some forms, very rare cases, he gets pleasure by someone if someone urinates on him or if he urinates for other woman, other partner. Pyromania, here the sexual pleasure gets by lighting, firing some objects. In most cases of pyromania, there is underlying sexual disorders. Some of latent form of sadism, and other obtain sexual gratification and satisfaction while seeing the flames or destruction of building. Just seeing by fire or destruction of building, they get sexual gratification. Next is scatologia. It is associated with obscene telephone calls. Say they call some unknown person and have some obscene talks and get sexual gratification. Caprolalia, it is sexual excitement is obtained by using some obscene languages. So by talking some obscene languages, he gets a sexual gratification. Caprolagnia, it is sexual excitement is associated with sight or smell of feces or defecation. Again, it is a extreme form where the person gets gratification by just sight or smell of feces or defecation, active defecation. In extreme cases, very rare cases, he may try to defecate or he may force the other partner to defecate on him to get sexual gratification. Urolagnia, sexual excitement in which associated with sight or thought of urine or urination. Similar to anism, it is urolagnia is sight and thought of urination is gets the sexual excitement. Narcissism or is a condition. It is called as also called as self-love, which may or may not indulge in sexual excitation, where the person have a intense love towards himself. That is also called as narcissism. Pygmalionism is a falling in love with the object made by him. So anything when the person creates some objects by like any woodwork or any part, he gets attached to that object and gets sexual gratification by just by observing that object. Telephone scotolagia, it is obscene telephone calls are made usually by heterosexual males who call known or unknown females to carry out sexually provocative conversions. Telephone scotolagia. Similar to that, there is also texting where they get sexual gratification by texting the other woman, other person, and talking in an obscene way to get sexual gratification. Next is indecent assault. It is offense committed to a female with the intent or knowledge to outrage her modesty. This is usually sexually motivated and obviously done without her consent. So in this, the person tries to kiss any part of the female body, touch, press the breast or prior parts, including the thighs. So he may try to outrage the modesty of a female. That is called as indecent assault. Sometimes a medical practitioner can be accused of indecent assault if he examines a female patient by stripping her clothes without her consent. So the any practitioner should be aware of that he should examine the female patient in presence of a female nurse. Then only it should be done. Otherwise, he may lead to get sued by the patient for indecent assault. These are my references. Thank you.